A very good morning and welcome to the Quality Measurement in Health Professional Education, Revisiting the Metrics, our international conference, which I'm very pleased that kicks off today with the pre-conference workshops. Assessing the quality of health professional education interventions is a task that appears more difficult than the comparable task with clinical intervention. What to measure, how best we can measure it, and so what are important questions we are struggling and trying to find answer to it. The aim of this conference is to create an opportunity for health professionals, educators, regulatory bodies, healthcare authorities, public and private healthcare services providers to interact with experts in the fields of quality and assessment, share experiences, and how to introduce new assessment methods in their own contexts. The speakers are scholars and leaders of innovations in health professional education. The conference will be an excellent opportunity to meet, discuss, and exchange opinions and best practices in the field of assessment and program evaluation. In the first workshop this morning, my very dear friend, Professor Lambert Schuwirth, the chair of Prideaux discipline of clinical education, Flinders University College of Medicine and Public Health, Adelaide, Australia, is going to kindly present through his workshop, a very important topic, which I hope all of you will enjoy it. How to design assessment for learning programmatically and even online. I'm not going to take a long time in this presentation because I want to hand it over to Lambert, and thank you very much, Lambert, for accepting our invitations.
Professor Lambert, you may share your screen now.
Yeah. Here we go. Okay. Do you want me to start?
Yes, please.
Yeah. Beautiful. Yes. So, good morning to you all. It's afternoon here in Australia, but I hope you'll have a lovely day ahead of you. First, I want to thank Professor Hamdi for this invitation and Dr. Alabat for her support. I think it is amazing that you've been able to bring together a group of international scholars and delegates who are interested in this, because in education and specifically in assessment, I think we're on a turning point in its history. So before I start with the how to design assessment for learning programmatically, I think an important question is why? Why would we? And what I want to do with this 1.5 hours that we've got is to engage with you as much as possible. Because if you were there sitting and listening to me talking 1.5 hours, that would be boring. So let me first try to gauge your interest, your views. So please use the chat or the Q&A to type in your views on why would we even think of designing assessment for learning programmatically. Please go ahead. I'll give you ample time. Yes, thank you. That's helpful, because what you're basically saying is that assessment drives learning, and assessment is also important to see whether the learning goals, the objectives, the outcomes of the course are really achieved, or whether the students have achieved the learning they should achieve. I'm going to challenge you and to provide feedback. to avoid bias? We're getting closer to the question, because when you say to achieve the outcomes, to make sure that the goals are met, etc., that's about assessment in general. But we've been doing that assessment for many years, decades, so to speak. So what's the problem that assessment for learning and that programmatic assessment, what are the problems that they're trying to solve? What do you think? So somebody said, can you please repeat the question? Yes, very happy to. So we have been assessing for a very long time. I mean, the earliest publications about assessment date from the 1920s, and there's probably a lot before that. But what is so unique about programmatic assessment and assessment for learning that we've decided to go in the direction of programmatic assessment and assessment for learning? Okay, thank you. That is helpful. So let me briefly summarize the history of assessment in medical education or health professions education as, and that's uniquely my perspective, but the way when I started in assessment to where we are now. So you could say that when I started in assessment, the dominant view that was that assessment is supposed to be an objective measurement of competence. So the main focus of everything I did in my work was to ensure that we had an optimal measurement instrument. So I did a lot of psychometrics, classical test theory, generalizability theory, a lot of item vetting and multiple choice development. And so it was all about measurement. But then mid-1990s, something changed. And what changed is the realization that there are so many aspects of competence that cannot be measured. As Einstein once said, not everything that counts can be counted, and not everything that can be counted counts. And we realized there were many things that only happen in actual practice and need to be observed in actual practice and require human judgment. So that's when the era where workplace-based assessment started, subjectivity was embraced, and human judgment was seen as part of assessment. But then we realized that it is not subjectivity or objectivity. It's not just judgment or measurement. It is actually a combination of judgment and measurement. So when we say programmatic assessment, we actually say that what we're trying to do is to capture competence in the same way as a clinician would capture health. And if you capture competence, you need judgments, qualitative information, and you need quantitative information. As much as a clinician, when I order a lab test, I expect a number, and that number is meaningful enough to me. But when I order a pathology report, I want a story. I want a story of a narrative of that pathology, which is also meaningful. So programmatic assessment is basically saying, let's not talk about an either it's a measurement or it's a subjective human judgment, but let's realize that in the synthesis of all that information, we need numbers and we need words. We need more objective or structured types of assessment, and we need more subjective, individualized types of assessment. And how do we combine that assessment so that it gives us a meaningful picture? And I will go into the details of the principles of programmatic assessment and assessment for learning throughout this 1.5 hours. So some said constructive alignment. Somebody wrote, actually assessment is or should be part of learning. And our views on learning with EPAs and workplace-based assessment, but also with competency-based assessment, our views on what constitutes a good doctor have changed. So necessarily our views on what constitutes good assessment have changed as well. And it is important, somebody wrote constructive alignment, it is incredibly important that the assessment matches on all levels, fundamentally, in principles, in values, that our assessment matches the way we try to educate our future healthcare professionals. Well, if that's the why and how it has historically developed programmatic assessment and the notion of assessment for learning, then the question is how. And unfortunately, I know there is a 12 tips paper on programmatic assessment, but what we realize is that assessment is something that you have to design to cater to your own organization and your own country or your own society. So I am not going to talk about a stepwise approach. It's not an algorithm, but I want to go through the fundamental principles of assessment for learning and programmatic assessment. And it's those fundamental principles, when you get them, that will allow you to apply them in your own organization. Look at it like the basic pathophysiology of illness. If you understand the physiology, anatomy, pathophysiology of an illness, you're able to individualize your treatment to different patients who might suffer from the same illness, but require a different treatment individualized. And you can only build that transfer from one patient to another if you understand the fundamental principles. And the same here is the best way to guide you, to support you, if you ever want to implement aspects of programmatic assessment or assessment for learning, is to deal with the fundamental principles. If at this point in time you have any questions, you can raise your hands, and I'm happy to stop, and you can be unmuted and ask your question or put forward the thing that you want to say. So what are the principles of assessment for learning? Again, I want you to think about, and I'm not talking about programmatic assessment, I'm thinking about assessment for learning. What are the principles, the general principles for assessment for learning? Please use the chat box for that. Marvelous. What I've heard, or what I've read, is it needs to be authentic. There needs to be a focus on feedback. It needs to be objective, reliable, valid. It needs to, it can be more frequent. Objective comes back again. It needs to foster the student learning and learning process, follow a competency-based view, formative, flexible, feasible, and measurable. And there are some further ones. Yeah. Let me start with a couple of principles. Well, let me first start with objective, because I've seen that word come feature a couple of times. When we talk about objective, we often use it with different meanings. And it is important to realize that whatever we do or have done in an assessment, assessment is always a process at which we collect information about the performance or achievement of a student, and we evaluate, we value that information. That's why every process in assessment always contains subjective elements. let's assume that we're constructing a multiple choice test, a so-called objective test. But before we get to the test, we have decided we had to make judgments about what will be in the course or the curriculum. What is the blueprint for the test? How many items are we going to put in each category of the blueprint? What specific topics are we going to deal with in each category of the blueprint? What specific items are we going to use? How are we going to phrase them? How are we going to decide whether they're relevant or not relevant? And then finally, a very arbitrary decision, where are we going to put the cutoff score between a pass and a fail? So these are all measures of, or all phases in which we collect human judgment and ideas and perceptions. And it's very subjective, but it's a prolonged process, and hopefully it's a carefully thought out process. In the end, we present the multiple choice test, and even a computer can present the multiple choice test and calculate the score. So that would be the objective component. But every assessment design process includes subjective and objective components. But subjectivity is not the same as unreliability. If I have a multiple choice test on the whole domain of internal medicine, but it only consists of one item, it may be a so-called objective test, but it's barely a decent sample, and therefore it will be incredibly unreliable. So reliability and objectivity are different things. Tests need to be reliable, but they cannot always be completely objective. If we talk about reliability, we are actually talking about fairness. A test, if we talk about reliability and validity, we talk about fairness. A test must be fair. Every assessment process, program, or even every individual judgment has to be fair. It has to lead to an outcome that the student actually deserves based on their achievement or then competence. And that fairness is often reframed and rephrased into objectivity, but it's actually about fairness. So here are some of the principles that apply to assessment for learning. It has to be longitudinal. There has to be a follow-up, a combination of generic and topical. The feedback has to be rich. Student engagement is required. The learner has to assume agency, and the learner has to take responsibility and accept accountability for the learning. Let me deal with each of these individually. Longitudinal. Here's an example. Progress testing is an approach to assessment in which the sort of knowledge-based test is given at all students of all year classes of a medical school, and the knowledge is attuned to graduate level. So what you would expect a graduate to know, to have in their biological memories, 2 AM knowledge. And of course, because it's given, a progress test is constructed, a new progress test is constructed 3 or 4 times per year. And every time at each moment, there is a new test, and all students sit the same test. So what you can basically do is you can generate a growth curve. That's longitudinal. Then the results at periodic moments, at certain moments, the results of a collection of tests, typically at the end of the year, 4 tests or 3 tests, those results are somehow combined, and a decision is made as to whether the growth of a student is sufficient to warrant the advice that they are ready to progress to the next phase. So this is a longitudinal way of assessment where not every assessment moment is a decision moment, but where you basically have collection of information over time until you have enough information to make a decision. So longitudinality, longitudinal assessment, basically means not only over time, but also a disconnect between assessment moments and decision moments. It is what you would do in your clinical practice as well. You wouldn't just have one lab test, make a diagnosis, and then when the next lab test comes along, make another diagnosis, and then you do a history, and yet there is another diagnosis. What you do is you collect information, you postpone making a diagnosis until you've got information that makes sense. That's a similar longitudinal approach. Oh, there's one point in the chat that I want to. I'll get to that. Let me write that down. Shouldn't assessment be sufficient to discriminatory between students? I should not forget this. I'll come back to that at the end of this part on when I get to assessment for learning. So that's longitudinality. If we look at the follow-up, we need to have a means for follow-up. What we do here at Flinders, for example, we do have progress tests, but rather than just saying we combine results in order to determine whether you are good enough to pass, to go on to the next phase or next year, we actually present the progress tests to our students, and they have to sit them and take them seriously, but we want them to analyze their strengths and weaknesses, to see where they did well, and preferably where they consistently did well and where they consistently did poorly. And we want them to analyze that in their portfolio. And I'm deliberately not using the word reflection, I'm deliberately using the word analysis. And it's an analysis like any clinician would do. You review the information, you say, how is my patient doing? What is going well with my patient and what is not going well with my patient? So when things are not going well with my patients, where do I need to devote my therapeutic management attention to? And we want the student to analyze, where is my strength? Where is my weaknesses? When there are weaknesses, how come that these are weaknesses compared to my classmates? And we want them to put that in a portfolio, to discuss it with their mentor, and to formulate learning activities and learning goals. The next time, the next progress test is basically another diagnostic to see whether they've been able to remediate or to remedy their weaknesses. And that way we build a spiral. So that's what I meant with a follow-up. I'm quickly going to check the chat. I am, somebody asked for the PowerPoints. I am more than happy to share the PowerPoints afterwards, because otherwise, if you start browsing through the PowerPoints, you, some of my gags or some of my surprises that I want to use are already explained, and that doesn't work. But I'm happy to share the PowerPoints. Dr. Lambert, I'll send them to you happily for distribution amongst the participants. So this is what I meant with longitudinal and follow-up. So it's not just disconnecting assessment moments, not making every assessment moment also a pass-fail decision moment, but combining information, but also making sure that the student actually engages with that information very early on and includes that in their learning activities. So here's another example of what I mean. Let's assume very often when I'm asked to review assessment systems, I ask, do you do workplace-based assessment? And people say, yeah, we do workplace-based assessment. For example, we conduct mini CX assessment. And let's say we do 6 mini CX, and then I ask, does that lead to a score? Yep. So you've got 6 scores or score patterns. Yes. So do you also give feedback and require learning goals? Yes. Okay. And then invariably I ask them, what is more important to you, the score or the feedback, the engagement with the feedback and the learning goals? And up until now, everybody has said, no, the feedback and the learning goals. And I say, which part is summative? The scores. Duh. That doesn't work. So if you if you have the same system, let's say you've got 6 mini CX with scores and feedback and learning goals, and you apply an assessment of learning mindset to ensure that the student has reached a certain level of competence or a certain end score, then your score is summative and the feedback is formative. However, if you apply an assessment for learning mindset, the things change. Now your score is formative and the feedback and the learning goals are summative. So the score is when you review the mini CX, you tell the student, I've given you a 5 out of 9 because, and the because enters the feedback phase and it leads to learning goals. And like I said, it's not just the longitudinality, but also the follow-up. So the learning goals emanating from that first feedback session have to feature in the presentation of the next mini CX. So ideally, the student is able to explain during a next mini CX how they have used the feedback of the first mini CX. Compare it to when you submit a manuscript to a journal and you receive the decision major revisions, you are expected to send in a revised version of your manuscript, but also submit a table of modifications. So what was the feedback that you got from the reviewers and how have you dealt with that feedback in the revision of your manuscript? So looking at the first manuscript as your first mini CX, the reviewer's comments and the editor's comments as your feedback, and then your table as the activities that you have deployed to improve your paper, your manuscript as a learning goals. And that's how you apply it to a second learning goals. If you have that principle of revising a manuscript, that's actually the principle of longitudinal engagement and assessment for learning. So if you want to change from an assessment of learning, if you want to change from an assessment of learning to an assessment for learning, it does not always mean that you have to build a whole new assessment program. It's just a different way of thinking of how are you going to use what you already have. I'm quickly going to check the chat. One of the questions is, what are recommended numbers? And that is a logical question if you come from that psychometric testing paradigm, because when we were still in that changeover from thinking about testing and workplace-based assessment, and the original paper by John Orsini and on mini CX used a generalizability approach to demonstrate the reliability of workplace-based assessment, and that was logical at that time. If you wanted to have a magic number, it is somewhere between 7 and 11 if you apply standard psychometric theory. But we'll get to that. There are different ways of demonstrating reliability, and I'm using inverted commas because reliability can mean so much more than just classical test theory reliability. So how is, and I'll get to the difference between assessment for learning and formative assessment, because that's a confusion that I often encounter, where people see assessment for learning and formative assessment as the same thing. As you can see, for example, in this, the green in the assessment of learning is the formative part, and the score is the summative part. So the scores in an assessment of learning are used to make a decision as to whether the student is okay or not, can progress or not. And the feedback is just feedback, formative, be happy with it, whatever you do. In an assessment for learning, the scores are more the feedback or the formative part. So they are a description of where you are. And perhaps at the end, we still have to make a decision whether it's good enough, but the feedback and the learning goals are summative. So the student who doesn't engage with the feedback, the student who doesn't understand the learning goals and doesn't enact the learning goals, demonstrate that they've done the learning goals and done the requisite improvement, is a student who fails. Again, if you submit a manuscript to a journal and you get reviewers' comments and editor comments, and you do not engage with those reviewers' comments and editor comments, and you do not improve, you won't get published. That's summative. And the same here, a student who doesn't engage with that feedback and repeatedly doesn't engage with the feedback is a student who fails. That student doesn't progress. And we frankly would believe that that's a student who is at risk after graduation, because they never engage with feedback. So they will stop after graduation. They will stop after their real tests are done, and they will not continue to progress. Yes, assessment for learning means that the summative component is on the learning. And that the student has to engage with learning. So that brings me to the next point, is that, of course, in order to, no, I'll get to one thing first. And this is a difficult one. So in an ideal situation, an assessment for learning program has generic components which are linked, and the feedback is linked to the domains of interest. Let's say you've got 4 modules and one is on cardiovascular disease, the second one is on renal diseases, the third one on respirology, and the fourth one on gastroenterology. But I still want to see whether you improve in your role as health advocate. Do you gain a better understanding of what health advocacy means? Are you better able to be an advocate for your patients? Are you better able to pick up, to bring in the communication that you need for a health advocate? And of course, I don't expect you to be very, very good at that at the beginning, but you learn some of health advocacy in your first module of cardiovascular diseases. And whenever health advocacy is an issue, I will use some elements of your work in cardiovascular diseases to explain where you could improve on your health advocacy. Your next module on renal diseases, there will be elements in renal diseases where, again, your health advocacy is required. And I expect you to be at a higher level of health advocacy, to be better able to identify issues, to be better able to word and to be more agile in your health advocacy, what have you. And then you go on to your next model on pulmonology or respirology, and your fourth module on gastroenterology. So I might even have a same rubric, perhaps a narrative rubric, across the 4 modules, but every time I give you feedback, it is embedded in the cardiovascular, renal, respirology, or gastroenterology. And I would do the same with your role as scholar, or with your role as medical expert, or your role as communicator or collaborator. So I expect you to grow in all these roles, and I expect you to be able to apply them in the cardiology, respirology, renal diseases, etc. So I expect you to constantly be able to connect that domain-specific knowledge and competencies with the generic growth in competencies. That's not an easy design task, but that's the ultimate goal of an assessment for learning in a competency-based program. Yes, somebody said assessment for learning can be considered as formative, and assessment of learning can be considered as formative. Yes, and they both may have summative components as well. The question is, where do you put the summative weight and where do you put the formative? Absolutely. So assessment for learning basically said does not only have 2 legs, it has 3 legs. The assessment for learning has the leg of how are you doing at the moment? The second leg is what are your strengths and weaknesses, and what do you need to do for the next period of your learning? And the third one is, if you continue this way, will you be at the required level at the end? A prognostic one. So there is a diagnostic, a therapeutic, and a prognostic. And again, the analogy with clinical medicine is compelling. What you do as a clinician all the time, you diagnose, analyze, you instigate therapy, therapeutic management, and you try to formulate a prognostication as to the duration of the illness or any other prognosis. And if you think of assessment for learning as a similar way of doing that, so every time when you're dealing with designing assessment, when you're dealing with students, every time you think about that diagnostic, therapeutic, and prognostic leg, that's the essence of assessment for learning. And of course, if I want to steer my students' learning, I need to give them rich feedback. And why is rich feedback important? It's not just important because it's nice. It is important because the traditional testing approach, the way the traditional testing approach drove student learning, was mainly behaviorist. Behaviorist means there is, the student exhibits a behavior in response to a stimulus. That behavior can be reinforced or modified by positive and negative reinforcement, by positive and negative punishment. And in a nutshell, positive reinforcement means the student portrays the behavior that we want. So we do something that the student likes, like an award or a prize. That's positive reinforcement. Negative reinforcement means the student does something that we want, and therefore we take away something that the student does not like. For example, the best student gets a fee waiver. Positive punishment means the student does something that we don't like, and therefore we do something that the student doesn't like. That's your slap on the wrist. That's a positive punishment. And negative punishment, in the end, is the student does something that we disapprove of, and therefore we take away something that the student likes. If you don't finish your plate, you don't get dessert. That's a typical approach to negative punishment. But behaviorist driving of student learning only goes so far, because we know from years of research that as soon as the reinforcement of punishment are taken away, the behavior fades. And there are ways of making that fading away a bit slower by unpredictable reinforcement, etc. But in the end, it will fade. And what we want to ensure is that our students continue to learn and assess and be assessed and want to be assessed after graduation. Because if we're only able to use behaviorist drivers, reinforcement and punishment, or punishment and reward, then, and the behavior, the wanted behavior, the learning behavior, the continual improvement, the lifelong learning behavior is what we want. We need something that continues to work after graduation. And that's where feedback comes in, because feedback produces a meaningful narrative. It's not just punishment and reward. It helps the student to steer their learning, and it gives them agency. What are the principles of good feedback? Question to you. Timely? Yep. Immediate? Both sides? Constructive? Descriptive? On observed behavior? Yes. Polite? Unbiased? Specific? A dialogue? Ah, self-explainable. I didn't think of that, but it's a great one. Frequent. Let student reflect first. Yeah. And somebody raised their hand. Clear, that's also a good one. Yeah. Free from prejudice. Yeah. Sandwich technique. Empathetic. Yeah. Absolutely spot on. The things that you write are absolutely spot on. The first one is there has to be a shared meaning making. If a student isn't receptive to your feedback or doesn't understand your feedback, if the student doesn't understand your feedback, it's a waste of time. And you don't want to waste time. For me, as a pragmatist, as a bit of a pragmatist, to me, learning is the currency. It has to be about learning. If feedback doesn't lead to learning, it's nice, but it's pretty useless. And the ways to ensure that you're on the same page is to partner with the student. And there are different ways of doing that. One way is to engage in the dialogue, or let the student reflect first, or to set the scene, or to start with positive feedback, or to meta communicate. And let me explain the latter. To meta communicate is where you start communicating about what you're going to say. So if I had to do feedback with one of my students and I would be pressed for time, let's say it's a busy clinical day, I've observed one of my students and I want to give them some feedback, but I only have 4 minutes and then I have to go to the next patient. What I would do is probably say, listen, I've just observed you. I'm happy to talk about this later, but there are 2 positive points and 2 negative points I want to discuss with you. The positive points I want to highlight because they were so strong and I want you to be aware of that and retain them. And there are 2 points for improvement, which I think I need to highlight so we can work on that for the next time. That's setting the scene, communicating about what I'm going to say, and therefore hoping that the student will be receptive to that as well. So whatever you do, whether it's a sandwich technique, whether it's how do you think, let the student reflect first, or whether it's opening up and say to the students, are there any questions, specific points you would like feedback on? All those things are basically to make sure that you and the student are on the same page. Because if the student has the impression that you don't have their best interest at heart, or if you do not have the student's best interests at heart, you're basically wasting time. And again, if feedback doesn't lead to learning, don't even bother. So in order for it to focus on learning, and some people wrote that as well, it has to be concrete. Try to be better is not concrete feedback. And it has to be concrete in such a way and constructive that it can lead to something that the student can change. So try to be more assertive is not good feedback. But if somebody is not very assertive and finds it difficult to communicate with new patients, or to clearly delineate their boundaries, it's no use saying, oh, you have to delineate your boundaries better, or you have to be more assertive. What the feedback is about is, how can I help you to find ways to delineate your boundaries better? Or how can I find ways for you to deal with patient care, even when you're not a very assertive person? So feedback is not about changing who you are. Feedback is changing about how do you manage who you are. So that's a concrete and constructive point. it has to be in a language that the student understands. I used to play volleyball, and as a junior, I remember many games in which the team captain shouted at me, say, "You're a free net defender. Come on, you're a free net defender." I had no idea what he wanted me to do. Apparently, you are the free net defender meant that I had to be in a certain position. That was not meaningful to me, and therefore I couldn't enact on the feedback. So always make sure that your feedback is meaningful and given in such a way that the student, the learner, absolutely means what you mean with your feedback. And that's the way it can lead to SMART goals, which is probably for most students that I encounter what they have most difficulties with. And certainly when students start, I often need to help them with what does a SMART goal really mean. And important is that a SMART goal means that it leads to something that you can see as I've done it and it works. That is the most important thing. So as an anecdote or an illustration, I once had a student who wrote in her reflection, that was the final preclinical year, she said, one of my strengths is I'm an idealistic person. I went into medicine because I wanted to help people. But I actually dread starting my clinical placements because I know that people become more cynical during their clinical placements. I've heard that from many, and there's literature about it, and I heard it from many of my friends that they have become more cynical when they are doing their clinical placements. And then she went on and I said, well, here's a strength and a threat. That sounds learning goal to me. And she said, oh, yeah, you're probably right. And yeah, I'm going to formulate a learning goal. And my learning goal is I'm going to try to retain my idealism. And so I said, that's not a learning goal. That's a good intention, or in our culture, a New Year's resolution. And after some toing and froing, her learning goal was, I'm going to identify 5 senior registrars and 5 consultants who still have that idealism and that fire in their belly. And I'm going to ask whether I can interview them and see what strategies they have used to retain their idealism. And 2 months later, she came back and she said, I've done that. I've interviewed 5 registrars and 5 consultants, and I've got 14 different strategies and 12 will work for me. So that's what I mean with a SMART goal. And that's the challenge of the feedback giver and the feedback receiver to make sure that the precious time that is spent on giving feedback actually leads to something that can be achieved and that leads to learning. Otherwise, it's just formative feedback and it's not feedback for learning. Quickly going to check the yes, it's smart, specific, measurable, achievable, relevant, time-bound is indeed the acronym. But I wanted to highlight that sometimes it's difficult to make something measurable when you think in terms of good intentions or resolutions, and that you have to turn it into something that that can be so concrete, and where you can look back as a student said, yeah, that worked for me, and my learning has improved. I think respectful is incredibly important. And again, respectful can be seen as a value in itself. So from a deontological, ethical point of view, respectfulness is a value that I really subscribe to, but it is also pragmatic. It also has a practical point of view, because if there is disrespect, and the main cause, I think, for disrespect is poor communication, but also what some people wrote, prejudice, bias, including stuff that has nothing to do with the competence that you're trying to assess It has so all kinds of things that should not matter, which are taken into account into your feedback and your judgment. That's disrespectful. Or feedback or a situation where you are in a position of power and you don't, and you exercise that power in the wrong way. Let me give you an example of a disrespectful behavior, which is unintended. So here's a scenario. You are a family physician supervisor and you have 2 trainees in your practice. One of your trainees used to be an experienced emergency medicine resident medical officer. So not a specialist, not a consultant, but as a doctor, has been working in the emergency department for many years, so was well experienced in emergency medicine. But then he decided to pursue a career in family medicine, and you're his supervisor. But he's a bit of a, well, he finds the transition difficult. So every time that you've got educational sessions where you've got your teaching sessions, he's not there because he thinks he knows it all. And now you've organized a teaching session and he's not there. He's off to an elderly care facility to deal with a very complex patient case. So the question now is, what do you do? And the initial reaction, including my own initial reaction, was to say, I'm going to pull the power card. You will come to my teaching or otherwise you're out. But that doesn't solve anything, because what will happen is your registrar will turn up and not say anything, but he's there because that's what you asked him, or even ask nasty questions, so-called critical questions. I'm a critical learner, but undermine your teaching. Or actually tell you that you're wrong and no, there's a new review study that has showed, etc. So much better is to deal with this in a respectful way. For example, to engage in a conversation about, God, it must be difficult for you after having been so high up the ladder and so experienced in emergency medicine to start at the bottom of the ladder. And I can imagine that that's difficult. So can I do something to help you with that transition? Or perhaps even other elements which you want to bring in from your emergency medicine experience, do you want to co-teach every now and then? And it sounds very soft, but basically what you're trying to do is to be respectful and to bring each other on the same page. And that way you have a better chance of making sure that your teaching leads to learning and that your time is not wasted. Absolutely. So if you pull the power card, you kill intrinsic motivation, and it's about intrinsic motivation. So the student engagement is required. If a student doesn't engage with assessment, with the assessment for learning, the student fails. But what does student engagement look like? So how would you engage student with their own assessment? Have a think. Yeah, what I see, and I think there are some great responses. Self-reflection, add a bit of unexpectedness, pop quiz, but any other form of unexpectedness. Use your team, so use peer group, but also self-assessment, and realize that in the difference between self-evaluation or self-assessment and the opinion of others, in that difference, that's where the learning happens. Discussion, perhaps a bit more fun, bit more game, bit more creativity. I actually didn't include that, but it's a very important point. So let me. Yes, let them compare with the rubric. So make sure that your rubric is meaningful and that your rubric has narrative vignettes. Yeah, absolutely. So here are a couple of principles, and you mentioned a couple that I didn't think of, but that make very good sense. The first rule is the student has to do the learning. And too often, if I look at assessment programs, or educational programs, there seems to be a tendency that we want to do the learning for our students. So when we provided our students with feedback on the progress test and suggested that they had some sort of way of collating that feedback over time and looking at their strengths and weaknesses, etc., the first question was, can't the university provide a sort of prefabricated Excel sheet that does that for us? And I said, well, we could, but we won't. We won't, because then we will be trying to do your learning for you. And unfortunately, learning is always hard work, and you are the one who has to do the learning. I tell my students that there is a myth that learning should be fun. Learning is not supposed to be fun. Learning is supposed to be engaging, but not supposed to be fun. Disneyland is supposed to be fun. Learning is supposed to be good and engaging. And in every field of expertise known to humans, high levels of expertise require investment. If you want to be a top athlete, you will have to practice. If you want to be a top musician, you will have to put in the hours of practice, which is not always fun. If you want to be a top doctor, you will have to put in the hours of practice. There's no way around it. Or as somebody once said, if you want the path to expertise or to competence is the stairs. There is no lift or escalator. So, but being creative in the way you engage students, or student can be engaged, is certainly something that can work. So if there are lessons to be learned from gaming, if there are lessons to be learned from other forms of engagement, you would be silly not to use them. If there are affordances that the students now have that I certainly didn't have when I studied medicine, we need to use them. It would be silly if all our assessments are mainly based on paper and pencil or computerized paper and pencil and not include social media, videos, podcasts, etc. All the things that students nowadays have to demonstrate artifacts or to produce artifacts of their learning. So the student has to take ownership of the work, and that's where the peer group and self-assessment comes in. The student has to be willing to say, this is my work, I stand for it, and I'm able to defend my work. So if a student compiles a portfolio, there are two ways of dealing with this in an assessment of learning perspective with a portfolio. I would have all kinds of measures to ensure that the student includes everything, and we control that every artifact and every test result is in there, and we would have anti-cheating stuff. In an assessment for learning, I would periodically ask the student to be able to publicly defend the content of their portfolio in an interview. So if I submit my CV to a potential employer and I put 250 publications on it, and they would take out a random publication and I couldn't say anything intelligible about it, it shouldn't be on my CV because it's not a demonstration of my competence anymore. So in an assessment for learning, you would have these group, peer, self, interview sessions where you basically ask the student to demonstrate the ownership of their work. That way it's also genuine. Ooh, a lot of jets. No pain, no gain. Yeah. And I will share my PowerPoint. So the student is therefore responsible for their own progress or their own lack of progress. And we want to have all kinds of measures by which the student is actually required to take that responsibility. So Where formative assessment could be conceived as, yeah, it's soft and gentle and touchy-feely, assessment for learning is absolutely not soft and touchy-feely. And let me just check, did I get, so let me give you two examples. When we designed in Maastricht, when we designed for a new medical degree, a programmatic assessment for learning principles, there were a couple of things. Students had meetings with mentors, and those were the feedback meetings and the portfolio meetings. The students were required to write the minutes of those meetings. Well, for three reasons. The first one is perhaps a bit of a facetious one, saves the mentors, the staff members, a lot of work. The second one is that the student can never say, I didn't know this, I wasn't informed, because they wrote the minutes. And the third one is that it's the best way to see whether the feedback and what was discussed during the meeting had actually transpired. So I'm just checking for time. Yeah. So that is an important point. So the student has to take responsibility for their own progress, and the student can therefore never say, oh, it's unfair, I wasn't given all the opportunities. You've been given all the opportunities. If you didn't take the opportunity and take the accountability, that's not our problem. The other one is that if a student performed very poorly on one assessment component, we wouldn't organize any resets. Actually, the student would be required to analyze why they underperformed, what they're going to do about it, organize what they were going to do about it, and then find a way to demonstrate to us that they actually successfully remediated their work. We were not going to provide resets because we didn't create the problem. The student did. The student is the one who has to do the learning, and therefore the student leads. So now I'm going to programmatic assessment, and I'll be a bit faster here because this is more well-known and more intuitive. For the sake of time, I'm going to skip this and start with this. I said in an assessment for learning, all feedback and all the information has to be meaningful. And it has to be a meaningful triangulation or synthesis of information. And therefore, it needs to be multimodal. So this could be the components of a standard assessment program. Let's say there are some mini CX, there's a multiple choice exam, there are OSCEs, essays, what have you. In a standard testing approach, you get a score on the mini CX, a score on the MCQ, a score on the OSCE, and there's some magic formula that in the end tells you whether you pass or fail. In an assessment for learning, you take bits of the mini CX, which you can combine in a meaningful way, perhaps with parts of an essay and a 360-degree and peer feedback and what have you, and you bring that together into a defensible story about your role as communicator. You could do the same with health advocates. And you might think that's odd. That's not how we work. Now, that's not how we used to work in assessment. That's how we work in clinical medicine all the time. And my pet example is a patient visits you with complaints of fatigue, thirst, and frequent urination. That's your history. On physical examination, you see poorly healed wounds and you palpate weak or absent peripheral arterial pulsations. The glucose level is 36 millimoles per liter. You can easily combine that into diabetes mellitus. But in doing so, you've taken bits of a history, bit of a physical, and bit of a lab test and combined it. Actually, you've combined verbal or acoustic information with visual information, with tactile information, with numerical information. And you can combine that to make sense. So the principle, the basic principle of programmatic assessment is that you do the same with all the information that you have, that you combine them to develop meaningful conclusions and narratives about the progress in the competency domains. For that, it has to be longitudinal. And we talked about longitudinal. So we talked about progress testing and we talked about how longitudinal assessment means that you have to create a disconnect between your assessment moment and your decision moment. That's what longitudinal assessment does. And that separation means that the decisions happen independent at a point in time, independent of the assessment. So I first collect the results of the 4 progress tests, combine them in any meaningful way, and then combine them to make a decision. Which means that my decisions can be proportional. At the end of year 1, I can make a low stakes decision. And at the end of year 2, the decision can be more high stakes because now I've got 8 measurement moments. Let me go on. Here's an example of programmatic assessment. Let's say I've got all these things. You remember this, where I said, well, you've got all kinds of instruments and all kinds of sources of information. Let's see all all the A's as little snippets of information that I'm combining in my portfolio. And the portfolio, the orange triangle, is therefore a document that becomes ever richer with information. And if I don't have much information, I can only make low stakes decisions, or even at the level of formative feedback decisions. But the more information I get, the more I'm able to make high stakes decisions. So through that disconnect between assessment moment and decision moment, I'm actually able to collect more information until I'm certain enough to make a high stakes decision. If I do that well with the provision of feedback, the student will also know how they are traveling, because they also collect richer and richer information on a longitudinal basis to sort of predict whether they are traveling well or not. And that's a prognostic function of assessment for learning and programmatic assessment, which is a clinical principle. If a patient comes into your practice and coughing, you would easily say, did you catch a cold? But you wouldn't say, oh, you've got tuberculosis. In order to make a more high stakes diagnosis, you need richer diagnostic information. Similar principle. Which means that, and that brings me back to the objectivity and reliability and validity, that if you look at assessment as a whole program, there are different ways to support the quality of what you're doing. And of course, there is a simple psychometrics. You might have multiple choice tests as part of your programmatic assessment. Progress test, for example, is a multiple choice test. And you apply standard psychometrics, classical test theory as indicated here, or generalizability, or even item response, whatever you want. You can use it to show that your assessment instrument has reliability. But you can also apply the principle of saturation. You collect information until you've seen enough. Let's say, so from a psychometric point of view, you would say, in order to come to a reliable decision on mini CX, you need at least 7 mini CX observations. That's a psychometric approach to mini CX. But you can also say, on the saturation point of view, well, I've seen this candidate perform 4 mini CX with complex patients at a very high level of competence and performance. I think I've seen enough. You get a patient. Let's say you've got your patient with peripheral arterial pulsations, fatigue, frequent urinations, your diabetes mellitus patient. You say, I've seen enough to make a diagnosis. I'm not going to do any other invasive diagnostics. Well, ABH, A1C, but that's the only thing. You wouldn't do any MRIs here because you've saturated your decision. And in order to achieve that saturation, what you need is expertise, because you need the expertise to decide that you've seen enough and that you don't need to see more. And once you've got that expertise and you've got your psychometrics and your saturation, you've got all these methods, of course, you build them into an organization and build in procedural fairness. You know how at the beginning I say, it's not about objectivity, it's about a fairness, and it is about fairness. So all the measures that we take, whether they're psychometric, saturation, or qualitative, or expertise, they are all built into an organization to ensure that every student gets the fair feedback, the fair judgment, that they get the fair diagnosis, the fair treatment, and the fair prognosis. That's all. And we play with that again, and I'm using clinical analogies ad nauseum, but we play with that all the time. If I have a patient and I order a lab test, I am absolutely not interested in the lab analyst's opinion. I don't want a story. I don't want their perspective. I want a number. And the credibility of that number comes from population data, reproducibility, construct validity, or so they all come from sort of psychometrics or the statistics. And that gives credibility and quality to that number. If I order a pathology report, I don't want the number. I want a narrative. I want a story. I want the pathologist's opinion. And that opinion, that narrative, is credible because I trust the pathologist's expertise, because the story that they write down is clear, coherent, and plausible, and because it addresses my question. If the pathologist would give me a number and said, this has a Cronbach's alpha of 0.95, it would be meaningless to me. If the lab analyst would give me a story, it would be meaningless to me. So horses for courses, quality measures, thinking about quality is dependent on the type of information that you are constructing. So in programmatic assessment, there is the psychometrics, the saturation, the expertise, but there's staff training, there's student briefing, there's member checking. Are we all on the same page? There might be some sort of benchmarking, review of portfolios, finding where the cutoff is. What do we take into account? What don't we? Prolonged engagement, you see, rather than having one assessment at the end of the year, you follow a student, the learner, over time, and therefore you know what's going on, the right for second opinion, transparency, documentation, and what have you. I'm almost done. So the question then is, now you may think, yeah, these are all very nice principles, and I'll read the PowerPoints afterwards and I'll think about this. But how do you apply them in your own organization? And that's something where I can't help you, because in your own organization, you have to understand the culture of your country. And you cannot simply say, oh, my culture is inferior to the Western culture or to an Asian culture, and therefore we have to change our culture. You have to work within your culture. Your culture has strengths and weaknesses, just like any other cultures. You have to consider finances, the expertise of your staff, the buy-in of your staff. If you're the only one who goes for it, you probably won't have much success. What are the resources? What are the constraints? How courageous is your organization? Because it's a fundamental change in thinking. How courageous is your leadership? What outside pressures are there? Societal expectations, the colleges, we have to deal with the Royal Colleges, accreditation process, and of course, politics. All these things have to be taken into consideration. And when you think about the principles of assessment for learning and the principles of programmatic assessment and how they work together and what you're trying to achieve, and then you consider culture, finance, staff expertise, buy-in, leadership, courage, and all these things, if you consider what's doable, then you can set out a strategy or a path to any developments that you want to do. That's all I wanted to say, and that's quite a lot. I recognize. I will send my slides to the organization. I might take out some of the pictures because I'm not sure I hold the copyright or I'm allowed to do that, but I'll replace them by a description of the picture. And the picture I don't own are not relevant. They were just for illustration purposes. Can I invite you if you have questions, to raise your hand and ask those questions? There are a couple of hands raised. Dr. Alabat, could you please allow these participants to?
Sure, Doctor.
Thank you.
Just we have Mariam Shahdan. You are allowed to unmute yourself now. Can you unmute yourself?
Hello, hi. This is Dr. Mariam Shahdan from Dubai Medical College. And my question here is that, good morning, how are you? Thank you for the informative lecture. I mean, I really enjoyed it. One question and one field that I struggle with is that sometimes the learning culture of the students affects the overall assessment, and this varies from place to place. So how to accommodate that?
Yes, it's a two-pronged approach. And one is an approach where you do reach out and try to convince the student that you're actually on the same page, that you want to educate them as the best doctor that they can be, and they want to be the best doctor they can be. Which reminds me, sorry, Mariam, which reminds me that I talked about discrimination. So the old testing view was all about discrimination. It was all about, is John better than Jim, or Karen better than Mary? It's all about that. If John is not better than Jim and Karen is not better than Mary, I can't calculate a Cronbach's alpha or a generalizability coefficient, because it would be a division by 0. So our whole thinking is about pitching students against each other. The whole notion of assessment for learning is to support John in becoming the best doctor he can be, and the same for Jim and Karen and what was the other name I used? But so it's pitching the student in competition with themselves. How can I become the best doctor I can be, and I don't care about the others where they are? So that's a change of thinking. That's a change of thinking for students as well. And there will be outside pressures. I mean, residency training programs will ask you to provide a ranking, for example. But trying to convince a student that actually focusing on the process, on optimizing their learning, and that's not always more, but sometimes more effective, on optimizing their learning actually leads to better grades and better outcomes, rather than just focusing on the grades. That's not an easy one, doesn't work for all students. So the other side is inescapability. Like I said, in an assessment for learning, a student who doesn't engage, who cheats, who window dresses, is a student who fails. And simply because it's an ongoing process, I have collected so much information at the end of a year that I've got a dossier to fail a student. And I'm happy to fail a student, because it's not a one-off measurement, one-off assessment, which could be win or lose. It is something that has been a pattern. We have a principle, and then I'll stop. We have a principle in that 1 event is an incident, 2 can be coincidence, 3 is a pattern, and on patterns you fail.
Thank you so much. Thank you so much.
Thank you very much, Dr. Mariam, for your question, and Dr. Lambert for the comprehensive answer. Do we have a time for another questions, Professor Lambert?
I have all the time in the world. I'm sorry,
okay.
I talk too much.
Doctor, no, it's always pleasure, Doctor. Dr. Khulud Salah, you can unmute yourself now and ask your question.
Yes, can you hear me?
Yes, I can.
Yes.
Thank you for this informative session. My question is that to which level the curve system is fair in assessing the student? I mean by the curve system that there is no specific point for succeed and failure. I mean, there is no fixed point. It's if it is from 100, 50 is not the point. I mean it's depend upon the best one and the least one and the average in between. This is the point of the grade for success. To which level this system is fair and applicable?
Yes, so I personally do not like arbitrariness in decision making. So when we say that the pass-fail score is 50%, it's an arbitrary number. It's never 47.893%. And why? Because we don't like 48.973%. We like round numbers. So weightings of assessments are always 30% or 25% or 40%. They're never odd numbers. Which shows that it's a very arbitrary decision. But in a normal distribution, 1% change in pass-fail score, certainly around the mean, implies 4% differences in decisions about students. And these are decisions which are high stakes. So I don't like arbitrary decisions. What you do in programmatic assessment is basically collecting all that information. And in the end, you have to make a decision whether a student is ready to progress to a next phase or ready to graduate or not. You have to make that decision. Just like when you're collecting information about a patient who's admitted to hospital, at some point in time, you have to decide whether the patient can be discharged or not. That's also a yes-no decision. But you make that decision based on a historical rich information, and perhaps in a committee where you confer with each other and where you provide a decent rationale behind your decision. So the richer your information, the more defensible your decision and the fairer your decision is about a student. Whereas just plucking a number out of thin air and saying, even when you use a nice method like an EBAL or an ANGOV or a Hofstee, etc. Even if you do that, you're basically plucking a number out of thin air and say, well, here's where we put the line. Yeah. Does that answer your question?
Yes, I'm asking this because I'm recently graduated, and now I'm not having this confidence. I'm always doubting my result. I just feel like I don't have my real result. That's why I'm asking. And now I'm working as a teaching assistant, and I'm facing the challenges of also assessing the student, especially in this problem-based learning. Me and my colleagues, we feel that this is very subjective, and we need to agree upon assessment method for the student.
Absolutely. And let me tell you, if you are a 60-year-old white male high-level professor, you still doubt yourself all the time. It never goes away, but you learn to live with it. So the fact that you're doubting shows that you have a good realization of how much there is to know. And there's always, the more you know, the more you realize how much you don't know. So please don't beat yourself up.
Thank you. Thank you. I really appreciate this.
Thank you very much, Khulud. We have here with us Professor Hussam Hamdi would like to engage and in the discussion, and then we will continue in our discussion afterwards.
Very good morning. Where is my friend? I don't see Lambert.
I'm here, Hussam. I can see you.
Lambert, a million thanks for everything, and for accepting our invitation, for being with us today, for sharing your vast experience and words of wisdom with more than 2,000 participants in this conference now. Today, as you can see in your session, close to 300 are attending your workshop. Definitely, maybe 2 hotels in Dubai could have have been needed for this. But once more, you can't imagine our appreciation, my personal appreciation for that, and the invitation is open at any time. Now I think things are getting better than the situation around December, and very soon you will be traveling. So please, one of your stops is here. You'll be our guest. You will be we're looking forward to meet in person very soon, inshallah. I'm sure everybody, I was listening, and I think the almost 300 participants in your workshop will be looking forward to listen to your next presentation tomorrow. And thank you, Lambert. Thank you very, very much.
Thank you so much, Hosam, for allowing me to speak. And obviously, you know that I'm very passionate about this, and it would be an absolute pleasure and honor to be able to continue our conversations face to face.
I think there are still some questions. So,
thank you very much, Professor Hussam and Professor Lambert and all the attendees. We have few questions, and Professor, let me know how would you like to go. The session, the time is around 10:30, so there is another workshop that will start soon. So I'm suggesting if the attendee would like to continue in a discussion, or feel free to go to if you are assigned in the next workshop till we wrap up with the questions we have here. What do you think, Doctor?
I am more flexible, but you have to adhere to a program.
Okay.
Yeah, I understand. So I'm perfectly happy to leave it in to your decision, because you have to adhere to a program. Here it's Friday afternoon, and I've got all the time in the world, but I don't want to interfere with your program.
So for us, it is great pleasure, and for sure we don't want the session to end. We are capturing the questions from the discussion and Q&A. Maybe, Doctor, I will send them to you, where you can address these questions, and we'll send the answers for all our attendees. Okay.
Happy to do so. Yeah.
Okay. This is great. Just one more things we have here, a raise hand. Fine. So let me conclude the final remarks for our session today. Thank you very much, Professor Lambert. It's really outstanding, eye-opening session where you really show us how programmatic assessment can capture competency, especially in the way you address that. It's how we are capturing it in health and in clinical decision, and how we can combine, we need to combine objective assessment with subjective individualized assessment for the students, and the fact how we will use learning, the principle for assessment for learning. And clearly that the role of a teacher who is more into mentoring, providing feedback, following on the students' progression, engage them in their learning is really, really outstanding. I am sure we have a lot of things that we will start implementing immediately, updating some of our practices. We will keep communicating with you if we have any questions for sure. Thank you very much, Doctor, for your time and for your valuable time. And we will be looking forward to your keynote session tomorrow in the conference. Thank you very much.
Thank you very much for your support, and I'm looking forward to tomorrow.
I
wish you a very productive day.
Thank you very much. Thank you. And for all the participants, now there is two workshops running. You can choose which of them you would like to attend: the quality of evidence in measuring outcome in health profession education, and another workshop about exam bank health index, know the physiology of item to recognize the pathology. Thank you very much for your attendance. Looking forward to seeing you in other sessions. Thank you, Professor. Thank you. Thank you.
Bye-bye.
Bye.